Hi, my name is Dr. Adriana Zabrosky, and my purpose is to restore you to optimum health and keep you healthy so that you can enjoy life at its fullest potential. Now, before I discuss how chiropractic care can help you achieve this, I'm going to first discuss a little about what chiropractic is actually not, because one of the things I like to do is to clear up some of the misconceptions about chiropractic. Chiropractic is not the treatment of symptoms. Well, what is a symptom? It's an ache, it's a pain, it's high blood pressure, it's fever, it's tingling, it's numbness. A symptom is an alarm, and it's an alarm that's telling us that, hey, there's something going wrong with my body. So if we just merely treated a symptom, that would be kind of like turning an alarm off during a fire. Well, that would be ridiculous. We don't want to just turn the alarm off. We want to get to the cause of the symptom. Chiropractic is also not the treatment of diseases. Well, when you think about it, diseases are nothing more than an accumulation of symptoms. So I just said I don't treat symptoms. By the same token, then, I wouldn't be treating diseases. Chiropractic is also not for back problems. Some of you might be saying, wow, I thought that's what chiropractors do. I thought they're back doctors. But think about this. A back problem is a back ache, it's a back pain, it's a symptom. And I've just said several times that we don't treat symptoms. Chiropractic is also not a therapy. Now, therapies treat symptoms. And again, we don't treat symptoms. Chiropractic is also not the popping of bones, okay? When you hear that sound, when you crack a knuckle or you hear your neck crack or your knee crack, nothing is cracking. What happens is we get pockets of nitrogen gas that form in between our joints. And when you shift that joint releases that air pressure, and that's what's making the popping sound. It is also not a medical specialty. Now, chiropractors are considered primary healthcare providers, but we are distinct from the medical community. Medicine will look at things more allopathically. And what I mean by that is they'll take something from out of the body, like a drug, and put it into your body to treat a condition. Chiropractic works more homeopathically. And what I mean by that is that we work with your body in order to treat a condition. Chiropractic is also not unscientific. It's been around since 1895. There are over 300 techniques within chiropractic, and the technique that I happen to practice is what's called the Pierce technique. There are only 2 Pierce practitioners in the state of Illinois. It does require additional training. You have a bachelor's degree upon entering chiropractic college, and then you go 4 additional years to chiropractic college. You take 4 sets of national boards while you're in school, and you take some pretty rigorous state boards depending upon what state you practice in. So at this point you're saying, wow, chiropractic doesn't treat symptoms. It doesn't treat diseases. It doesn't even treat back problems. Well, how's chiropractic going to help me if it doesn't do any of these things? That's very easy for me to answer. Everybody who comes to my office already walks in with what's going to get them well. Because what will get you well is life. As long as you're alive, your very own body has the capacity to heal itself for whatever symptom or disease you may have. Actually, when you think about it, you're the world's greatest drugstore. And let me kind of explain what I mean by that. When you get sick, what happens? The thing that should happen is you should get a fever. When you get a fever, that's a good thing. It means your body's working. Your body knows how to heal itself. And it says, you know what? At elevated temperatures, I can fight this bacteria a lot easier, or this viral infection. The other thing that should happen is antibodies, which are natural antibiotics, should kick into your bloodstream to help fight the infection. Another example I can give you is when you overexert yourself. We did a lot of snow shoveling, right? Or yard work. Well, what should happen in that instance is endorphins, which are natural morphines, should kick into your muscular system to help ease some of the pain. So I've just given you 3 simple examples of the inherent recuperative mechanisms that we were all born with. We all have an innate intelligence within us that heals us for so many things. In fact, Deepak Chopra was quoted as saying that modern medicine, for all its advances, knows less than 10% of what your body knows instinctively. So what I'm going to discuss in this presentation is why sometimes these mechanisms don't always work, and why you do end up having aches and pains and all kinds of problems. Now, the way the brain communicates these incredible properties to our body is through the brain. This is how life is communicated. I'm not saying your brain is your life, but in order for life to be manifested, you have to have brain function. And there's two properties then that would be working in your body. Those two properties are resistance and regeneration. I'm first going to talk a little bit about regeneration. Suppose I cut my hand in this area. Well, obviously what would happen? Blood would flow to that area. And in that blood, there'd be red blood cells, there'd be white blood cells, there'd be antibodies, there'd be coagulants, which would clot it up. Then I'd get a scar and a scab and a whole new set of skin. Okay, I did that. My brain did that. The life within me did it. It knew to heal that skin. That's what happens when you break a bone. You go to the emergency room, of course, and the doctor sets the bone, puts a cast on, maybe gives you pain pills, but the pain pills aren't what's regenerating that bone. What does the doctor tell you? He says, come back in 6 weeks. And in that 6-week time frame, the brain sends osteoblasts and osteoclasts, various bone cells, to allow that bone to regenerate. Well, based on this principle of regeneration, a year from today, a year from viewing this presentation, you are going to have an entirely new body. That's kind of a nice concept. And here's why. Because this life within you, this innate intelligence within you says, in case there's something wrong with the heart or the spleen or the gallbladder or any of the muscles, let's constantly kill old cells and let's regenerate new cells. I don't know if you remember this, but we all learned that in 6th grade biology. Old cells die and new cells regenerate. Well, those cells are what are making up our organs and muscles. So therefore, the end result is every so many months you have a new heart, you have a new spleen, you have a new gallbladder. My hair, it's nothing but dead cells, as is the surface of my skin. So this process of regeneration is occurring all the time, 24/7, so that within a year's time you have a completely new body. Except for your bones take an average of 7 years to regenerate. So at this point you might be asking, well, if everything's regenerating, then how come there's people walking around with muscle aches and pains for 5 or 6 or 7 years, or a stomach problem for 10 years? Why would that happen? I'm going to explain that in just a few moments, but before I do, there's another property I said we're all born with, and that property is resistance. Resistance is your body's ability to fight off infection. If you have a good resistance, you're not going to get sick. You know, you can walk through a hospital, you're not going to catch any of the diseases. But if your resistance is down, you could be with a family member or a coworker and catch their cold. Well, with resistance and regeneration working at 100% capacity, we should have the potential to live to be about 120 years old. Do you know many 120-year-olds? I don't. Yet in the world, there's around 400,000 people that are over 100 years old. Unfortunately, most of them don't come from this culture. So what I'm going to show you here is what happens to resistance and to regeneration, two properties that your innate intelligence within you has provided you with, and what you can do to improve upon those properties so you can live long, healthy lives. The way the brain communicates these incredible properties is through a long cable called your spinal cord. When you think about it, really your spinal cord is nothing more than an extension of your brain. So that's how that information runs down from the brain. It goes down through the spinal cord. Well, now that information needs to get everywhere. So how does that happen? Well, it branches out into these little nerve roots. And these nerve roots are located in between the vertebrae. And those nerve roots then supply all of your organs and all of your muscles. Now, when I talk about all of your muscles, keep in mind you have over 600 muscles in your body. So in order for each and every muscle to be working properly, they all have to have that information beginning in the brain. The same holds true with your organs from head to toe. Your eyes, your glands, your sinuses, your heart, your lungs, your colon, your liver, your bladder, everything, in order for it to work properly, has to have that information beginning in the brain. Now, a few moments ago, I said, well, how would the stomach not function properly for 10 years? Why doesn't it regenerate properly? By all means, you should get the stomach checked. If you look at that chart, you can see where the stomach is. But if the problem keeps recurring year in and year out, maybe the problem didn't start in the stomach. Maybe there's something that happened between the brain, the spinal cord, and the nerve root that didn't allow to send that information to tell the stomach how to regenerate properly. The brain is protected by a vault known as the skull. And what protects the spinal cord is what a chiropractor works with, and that would be the spinal column. The spinal column is composed of 26 segments. A front and a back view of the spine should obviously be straight. However, the side view of the spine should have various curves to it. Looking at a side view of the lumbar spine, what we have are vertebrae, and in our lumbar spine we have 5 vertebrae. Now, in between those vertebrae, we have what are called discs. Discs serve 2 functions. Number 1, these are the discs, and they serve 2 functions. The first function is they serve as shock absorbers. If we didn't have these discs cushioning in between our vertebrae, we'd be causing a lot of wear and tear on our vertebrae. And they would begin to erode, they would begin to fracture. But secondly, these discs are important because they make up the openings in between the vertebrae. And why that's important is because that's where those nerves are exiting from. Well, due to stresses, due to strains in life, bones have a tendency to move out of alignment. And when that happens, they begin to put pressure on a nerve. Researchers have found that all it takes is about 45 millimeters of mercury pressure on a nerve for 3 minutes to change the impulse of that nerve by 60%. Let me explain what that means. Suppose my hand was one of these nerves that were exiting. And if you put a quarter on the back of my hand, that's about 45 millimeters of mercury pressure, you would impact that nerve by 60%. That means now only 40% nerve supply is able to get to that organ or to that muscle. And when that happens, we call that a subluxation. When a bone moves out of alignment, puts pressure on a nerve, preventing 100% life to be communicated. So many of you who go to the chiropractor are going because you're concerned about the pain, okay? But something you might be now more concerned about is, well, what happens when a bone moves out of alignment and it puts pressure on a nerve, not just for 3 minutes, but what if it's been doing it for 3 days or 3 weeks or 3 months or 3 years? And not only what's happening here, but what about where that nerve's going to? Well, it's not getting that there properly. And again, when that happens, that's called a subluxation. The next view shows an actual photograph of a subluxation. And in that photograph, you can see the vertebra moved out of alignment, and the circled nerve root is where the vertebra is subluxated. Now, you can see the obvious difference in that nerve. I stress that that's a photograph because that is a photograph that was taken on an autopsy of a man who died from kidney failure. The time of his autopsy, he didn't know he was subluxated, or at the time of of the occurrence of the kidney problem. Now, this is an actual autopsy, and when this nerve was traced, it was the nerve that was going to the kidney. I doubt very much he called in and said, I'm subluxated, because he may not have known it. Because 80% of the time you don't feel the subluxation, and I'll discuss that in a moment. But here's what happened to this particular situation. So, this man's nerve supply going to the kidney was not sufficient, and he probably got a kidney infection because his resistance had been lowered. And they gave him antibiotics, which treated the infection. However, those antibiotics did not treat the subluxation. And then the subluxation became worse. And now, how do you suppose his kidney was able to regenerate with a nerve supply going to that area like that? It wasn't. And eventually this man died. Did he die from kidney failure? Well, I just said he did. But as far as I'm concerned, he died from a subluxation. Think about it this way. Had he never been subluxated, he would have never had a kidney infection. The kidney infection was the alarm. The subluxation was the cause. This view right here is what made me decide to become a chiropractor. You know, in grade school, nobody checked me for subluxations, or in high school, I have a bachelor's degree in psychology. That's what we studied, was the brain and the spinal cord. But it wasn't until I met with a chiropractor who showed me cases of people who were seriously ill as a result of subluxations. And when I first saw this, I thought, why isn't everybody getting checked for subluxations? Because if your nerve supply isn't functioning properly, your body's not going to function properly. That innate intelligence is not going to be able to work and send that information the way it needs to. Again, I mentioned about somebody with back pain, maybe not feeling the subluxation. And here's why. 80% of the time, we don't feel a subluxation. And that is because if you look at that nerve coming out, 80% of that nerve is functional. It's going to an area to cause something to move, to constrict, to dilate. Only 20% of that nerve is sensory. So unless the bone is on the sensory part of the nerve, you may not feel a subluxation. If it's on the sensory part of the nerve, you'll have a neck pain or a back pain. But if it's not on the sensory part of the nerve, maybe you're having stomach problems, maybe you're having allergy problems, maybe you're having heart problems. I'm going to just show you and demonstrate how that works. If you look at areas in the middle of the neck, you're going to see that the nerve supply goes to the sinuses, it goes to the eyes, to the ears, to the thyroid. If you look further down, that nerve supply is going to the heart. It's going to the lungs. Asthma, allergies, headaches would be up